Greeting everyone.
Yes,
Uh,
greetings. Good evening. Thank you for
yeah,
being
how's
patient.
everyone doing? Right. Yeah, so another month. I was just about to say another week, but we'll return to another fortnight
Yeah,
um,
once a month.
in the very near future. Um, because a lot of the studies and some of my old contracts are coming to an end. And it's time for the new contracts and new ways of going forward.
Yes, good evening, Sankofa, and good evening, Alan. And good evening,
Good
Dee.
evening, both. But yeah, so we're going to touch on the nervous system. And again, the most difficult job is not finding the information and explaining, well, the explanation is the difficult part, but it is really just making it make sense, because I know when we read, for the average person who might not be so medically in tune, if they're reading anything to do with the nervous system, it can create a lot of confusion. And because it's about, how one understands the nervous system from the point of their reality. And this is what we're going to try and do. Simplify things, but also just make you understand it from the awareness of where you are, which is most important. And the more I keep on seeing things on YouTube and, various educations, etc., the more I'm seeing that, practitioners and experts are really starting to appreciate not just the physical side of things, but the spiritual side of things. So for example, I was listening to a lady, forgot her name, a doctor, and she was talking about metabolism and all these metabolic diseases, and she's a really very much, you're seeing these practitioners now really starting to look at the bigger picture, the bigger reality of how stresses lifestyle and how certain patterns of behavior leads to the manifestation of problems. So you're seeing more and more examples and people gravitating more to this type of information because it makes more sense to them, and they're able to tie in the physical with the spiritual side of problems, and things are being explained in a more holistic terms like frequency, you know dis-ease being, one being out of frequency, one's body being out of harmony. Yeah, you see many examples of this now. um yes, our healthcare systems haven't caught up, but the experts, they're catching up. And, some of the past experts, they were there already. That's how a lot of us even got to this point. But yeah, so, it's not now just about presenting information, but it's about presenting knowledge that can be utilized in a holistic way and a practical way in a day-to-day way. So that's the difficulty with these presentations, rather than anything else. So let me start. All right. So when we're looking at the nervous system, um, we're looking at, how we really interact with our environment. And the nervous system allows, it really allows a space for our consciousness to, have a reside within the body. So when we're looking at a lot of the Western texts, we will see that the nervous system helps us deal with um, the sensation, our perception of our environment around us. And we perceive our environment through things like taste, touch, smell, and all of our other senses, hearing, sight, etc. And, that's how, as a child, we learn about our environment. So when you see a child putting things in their mouth, they're trying to learn about the environment through, their tongue. They're touching the environment. Learning about how things feel, if it's rough, if it's sharp, if it's something that they shouldn't touch again, through certain reflexes that it had to protect them. They're learning how things sound. They learning how their mum's voice sounds, how their dad's voice sounds. You know, they're learning about all these different things in the environment. So all this information they're being bombarded with, and it's up for now their nervous system to mature to understanding what's happening, and also so they can better interact with the environment. So another part of our nervous system is, to produce movement. So when we look at a child that's able to crawl, in order for them to explore the environment, they need to have a desire to move, to reach an object, to reach somewhere. And through that desire, that enables them to move forward towards an object. Um, so when we're looking at the nervous system, it's about how, we perceive the environment, how we can sense the environment around us, but then also how we can move around in our environment. So one of these parts of the nervous system is a very, the nerve impulses are coming towards us. And then another part is a manifestation of our thought process to produce movement. So we're going to touch on the basis of that. All right. So if we had to simplify the division of our nervous system, we will see that our nervous system comprises our central nervous system, which is here, the brain, and that's our spinal cord. And then we will also see that it comprises of the peripheral nervous system, which is the nerve fibers that come off of our spinal cord. Yeah. Um, when we're looking at, even from an injury level, we can see that most of the research, especially the research of the past, shows that any injury to the brain and the spinal cord is not reversible, and a person who had the injury of this area will get better, but the old thought pattern is that they will never ever fully recover. Whereas what we see in the peripheral nervous system is that someone can damage their peripheral nervous system and it can make practically a full recovery. As we move forward with science and advancements, I think what we'll see, and probably what is already out there, is that people can make significant recoveries if an injury is done to the brain and the spinal cord. But that's a space to watch. I know in my, university degree, you know, we was told about the limited healing capacity, and there's a variety of factors that may limit one from fully recovering. But, as we look forward, I'm very optimistic that, we will constantly keep getting better recovery. But yeah, there's so much around that topic. That's a whole lecture in itself, but that's the general consensus. But again, some of that information, as we'll see in the future, will become pretty old in regards to recovery. So when we're looking at the brain, so the brain is where all of our, where they say in simple terms, um, the consciousness resides. Um, as we practice more and go into more of the metaphysics and practice more Tai Chi, we'll see that actually consciousness resides in every part of our cell. but we're just keeping it simple and we're just keeping it kind of from a anatomical point of view. So we got different parts of the brain. And so we got the frontal lobe, which is dealing with, our higher thought processes, things like thinking, things like problem solving, things like planning, etc. And that's right at the front. This is only one part of the brain, so that will be the left hemisphere. And then remember, there's a whole other hemisphere, so it will be when we're looking at the frontal lobe, it's that part plus the opposite side as well. Then we've got the temporal lobe, which is this one here. And as you can see, it's at the side of the head, very close to the ear, you know, and that deals with memory, language, etc. And it's even interesting because when we're learning, or when we get children to learn to read, etc., we're getting them to repeat. And there's something about it being on that part of the head and our ear being in the same place to get, that kind of feedback, mechanism that's going on from the ear to that part of the brain. Then we got the brainstem, which is involved in involuntary responses, processes such as our breathing, our heart rate, etc. And when we're looking, even from a age point of view, and I'm not talking about age of how old one is, but talking about the oldest part of the brain, this part of the brain is older than other parts of the brain, you know. So even, if we go to the story of evolution, they say that, the basic functions like breathing, was obviously very president over other functions like higher level of thinking. So we can see how that would be the oldest part. And we can see how damage to this part of the brain is going to have much more significant consequences than damage to the frontal lobe, because breathing is the most important thing. And without that, we can forget about the rest of it. The cerebellum means mini tree, because when you cut it, it does resemble like a tree-like structure. This diagram is not the best to show it, but it does literally look like a mini tree within the body. And that deals with balance and coordination. Then we got the occipital lobe, and this is something that we've probably experienced it being that part of our head, which is basically right at the back of the head. And the way we may have experienced it, well, I know I've experienced that being that part, is as a goalkeeper back in the days, being hit at that part of the brain or falling backwards on that part of the head, automatically you'll see stars, you know. And then we've got the parietal lobe, which is basically like our proprioception. It's kind of like if we close our eyes, where our body is in space and time, and we can close our eyes without looking, move our elbow, and we'll have a good idea of how much degrees we're moving, etc. So the parietal lobe is very much, it's just our perception and awareness of where our body is. And, the first question I ask, because I'm always a skeptic, and I'm always a skeptic as to, not taking things for as another, as researchers say it is, I like to try and disprove things until I can't disprove it, until I can improve it to be true. That's the approach I just take in life. That's even the approach I've taken with Tai Chi, trying to disprove it until actually you can no longer disprove it because you've practiced and you're aware of it, that actually it makes sense. But the way I've seen these things, and understand that these different body parts, or different parts of the brain, I should say, are true to their function, is what, healthcare practitioners see all the time. So things like a stroke um, can make us aware of exactly what each part of the brain does. So with our advancements in technology, where we've seen someone with a bleed in the cerebellum, and we can literally see the pictures on MRI, etc., and we can have the images in front of us. Now, when we're going to see that patient with a bleed of the cerebellum, we will see the balance and coordination be, almost disappeared. So we will see the patients with a wide base of support. We'll see them very uncoordinated. We'll see them reaching for something and literally missing the target, you know. So, so yeah, we will see all of these things. Uh, sorry, bear with me. All right. Yes, so just making sure I'm still online. Okay, yeah. So again, we see with the frontal lobe that anyone that's had a stroke in the frontal lobe, we might see them become very aggressive. Sorry. So we might see them become very aggressive. We might see them displaying signs of extreme anger, or we might see them become extremely emotional compared to how they used to be. So that's basically an example of how we know what each part of the body does. That's just from a clinical perspective, because when we're looking at, further research and with the equipment and the technology that we have, we can see that, clearly, which what each part of the brain does. Okay, so I'm going to go forward to go back. So when we're looking at our neurological system, we can see that the neuron, which is this here, which is the smallest unit of our nervous system. And over here, we can see what we call the soma, also the cell body. And here we have like these dendrites here. And these dendrites can receive information from another cell, or receive impulses or hormones or chemicals from another cell, or detect chemicals in the environment, etc. So that's a soma. And let's say um, I'm going to show it actually in another slide, just as a fuller representation. But from the cell body, we've got a projection here. And this projection is what we call an axon. Yeah. So when the nerve impulse is generated and goes along, from the cell body, it travels down the axon as an electrical impulse, and it reaches the axon terminals, and these are the terminals all at the end here. And from these terminals, there's a synapse here, and the gap between the synapse is called the synaptic cleft. And from the synapse, it can release hormones like, neurotransmitters like acetylcholine, etc., to another axon where the information can further travel. Or it might reach a junction of, the muscles, and then it might help to send the impulses down the nerve so that it jumps and stimulates the muscle fiber. Yeah, so that's basically um, the neuron, and the impulses travel down the the nerve cell. So. let me see if this video, um, it should demonstrate it a little bit more beautifully.
Neurons communicate with each other, relaying messages throughout your body and powering all of your thoughts and actions. Neurons talk to each other using both electrical and chemical signals. Messages start as electrical signals traveling rapidly down a neuron. These signals are called action potentials. When they reach the gap between two neurons, the messages need some help to get across. The information is transformed from an action potential into a chemical message, which crosses the gap called a synapse. The release of those chemical messengers can trigger an action potential in the neuron on the other side of the synapse, conveying the message onward. Or it can quiet the message. This happens over and over and over. And with repeated activity, the synapse gets stronger, so the next message is more likely to get through. That way, neurons learn to pass on important messages and ignore the rest. This is how our brains learn and adapt to an ever-changing world.
Yeah, so yeah, that's a nice video demonstrating that. What's important to know, just on a side topic, is when we're looking at how the neurons can become strengthened, or the impulses or the message and the strength and the connection between one nerve and the other cell. When we're looking at things like addiction, this is why it's so hard to break certain habits, because the impulses are so strong. It's almost automatic. We just do things without thinking of it. We might have an emotion, might eat, a pack of custard creams or whatever. And then, the more we associate and the more we repeat certain behaviors, the more it becomes more, automatic. And at the same time, it can work to a benefit. So someone that's had a stroke and they've had certain neural connections damaged, they can then form new neural connections through repetitive patterning and through repetitive behavior, which will help to strengthen new neural pathways.
Neurons can...
Um, this is a video on axon potentials, but I don't know if I want to go into that in too great detail, actually. I think I'll explain it because I don't want things to get unnecessarily confusing. So basically, when we're looking at the axon, as you could see through the last diagram, we could see that the electrical impulse travels down the neuron. But what's happening, there's a series of chemical reactions which is happening or at certain levels. And what happens is as these axon potentials happen, or as these gates open and close, they allow certain chemicals in and then out of the cell. As it does that, it then generates an electrical impulse at each stage, which, for example, this gate might open, then an electrical impulse travels here, then the next gate might open, then that will travel further down. And as these gates are opening and closing down the cell, an electrical impulse is traveling down. So in saying that, I'm going to show the video now.
Propagation of action potential in an unmyelinated axon.
Okay.
In unmyelinated
Okay, so before we go into that, actually, let me just explain what myelinated and unmyelinated means. So basically, what we can see here is the myelinated axons. This is what we would see in our motor neurons. Yeah, and the reason why is we want them to happen very quick. So what we've got here, we've got these myelin sheaths, and these myelin sheaths help the impulses to, instead of taking its time to go through the axon, it jumps. So it happens a lot quicker, that action potential. So things happen a lot quicker and smoother down the cell. Whereas when you see the unmyelinated axons, things take a longer time to travel. And this unmyelinated, you might see that you'll find that more in our sensory pain receptors, you know, rather than our motor neurons. And there might be a reason for that. We don't want pain to be jumping and traveling fast. You know, that can be overwhelming for our neurological system. However, we do want to produce quick movement. So let me go back to the video.
Propagation of action potential in an unmyelinated axon. In unmyelinated axons, action potentials propagate as an interaction between passively spreading membrane depolarization and voltage-gated sodium channels. When one segment of cell membrane is depolarized enough to open its voltage-gated sodium channels, sodium enters the cell by facilitated diffusion. Once inside, positively charged sodium ions nudge adjacent ions down the axon by electrostatic repulsion and attract negative ions away from the adjacent membrane. As a result, a wave of positivity moves down the axon without any individual ion moving very far. Once the adjacent segment of membrane is depolarized, the voltage-gated sodium channels in that segment open.
So going back there.
Membrane is depolarized.
Yeah, so what you can see, yeah, that's the action potential going along the cell.
Propagation of action attract neg. As a result, a wave of positivity, visual ion moving very far. Once the adjacent segment of membrane is depolarized, the voltage-gated sodium channels in that segment open, regenerating the cycle. The process repeats itself down the length of the axon with an action potential regenerated at each segment of membrane.
Hi, so I thought I was going to show actually an example of this, but from what I've explained, you know, with the myelin sheath, it doesn't travel so slowly, but it jumps a lot quicker. So, all right, so when we're looking, so if I go back, let me go to the top here. So when we're looking at our peripheral nervous system, which is what we see in our nerves going down the arms, we call these nerves, yeah? But the nerves and the axons that travel from the brain, we call them tracts, yeah? So when we're thinking of nerve fibers, so imagine so if I go back here, so just imagine this part, the cell body, just picture that cell body. Now picture that cell body starting here, yeah? Now picture the axon going down, the long bit, and now picture the cell body and the axon going down. So the axon or the neuron, which is the cell body and the axon going down, when it's in the central nervous system, the blue bit here, it's known as a tract, yeah? When you see, let's say, the cell body here and the neurons going all the way down, we call that a nerve. So in the spinal cord and the brain and spinal cord, we call that a tract, but here we call it a nerve, yeah? So when we're looking at tracts, we got various tracts. So if we look, for example, at the spinal cord, I'm going to just stop sharing this for a second just to show you here. So the yellow bit is the spinal cord, and we can see it's protected by a vertebrae, yeah? So all of the tracts will be running in different segments along here. So if we looked at it cross-sectionally, let's say we might have the corticospinal tract here, we might have the spinal thalamic tract there, but they're all kind of running in its own section, yeah? We've got various tracts and they have various roles. So when we're looking at the corticospinal tract, we're looking at it helping the body to produce fine limb control. Then when we look at the vestibular spinal tract, we're looking at how it helps us with our posture and balance, etc. Yeah. So different tracts are responsible for different things, and different tracts will also have their root in different parts of the brain. So the one I'm going to show you a video on is the corticospinal tract, because that's the one that helps deal with movement.
Cell bodies of the upper motor neurons of the corticospinal tract are located in the cerebral cortex. Fibers of the tract will influence lower motor neurons that innervate musculature in the extremities and trunk. The axons of upper motor neurons begin their descent to the spinal cord by passing through the corona radiata and internal capsule. As the fibers reach the brainstem, they enter the middle portion of the cerebral peduncle. As they pass through the base of the pons,
So that's so far it goes through the different layers of the brain itself.
bundles are separated by the many pontine nuclei and their projections to the cerebellum, the pontocerebellar fibers. Note that the position of these corticospinal fibers is ventral throughout their course through the brainstem.
Yeah, ventral just means more at the front of the spinal cord.
At the most caudal portion of the medulla, most of the fibers begin to course dorsally and cross the midline. This is known as the motor decussation. Note that some axons do not cross the midline. The fibers that have crossed entered the lateral portion of the spinal cord and are known as the lateral corticospinal tract. At upper cervical levels, the lateral corticospinal tract.
Yeah, so now this is definitely going into parts of brain, but the spinal cord region.
Influences lower motor neurons going to neck and shoulder muscles.
It's a kind of crash course into into the nervous system. It starts getting interesting when we start looking at disease, etc. And problems like Parkinson's, multiple sclerosis, stroke. And this is from all these conditions. This is where we've derived a lot of our learning from. But yeah, hopefully, everyone, yeah,
Yes, thank you, Christos,
hopefully that would inform.
for your presentation on the brain and on the breaking down the whole the nerve thing, the nerves, the cell body. Man, that's how the web is created, isn't it? That network. When these when these cell bodies and these synapses
Mhm.
connect up. But you know, it's like what the brain is like one big cell body.
Yeah, come like it.
And then
Yeah,
the tract itself is like what, like one long
axon, yeah.
axon.
And then they kind
On a
of,
microscopic level, because on a microscopic level, how does that work? Because in between,
yeah, so yeah, you see the thing is you can visualize them because they've done like cross sections. But what
yeah.
usually happens, you've got like the first order neurons, which will be like directly from the brain to the spinal cord, and then it's at the level of the spinal cord. Can you see my screen there?
Mm-hmm.
So I can't see. Let me see how I'm looking. Oh, so Yeah, so you can see now where you got this like bulge here. So these bulges would be like a whole a
Ganglion.
collection. Oh, yeah, ganglion, which is basically the cell bodies in the peripheral nervous system,
Mm-hmm.
you know. So this will be then the start of like our second order neurons, you know.
Brain. You got one brain of a gang of lions, ganglion
Yeah,
of cell bodies coming together. That's like a little.
yeah,
I always thought that was an interesting word they chose.
yeah. So we got the cell bodies coming from the brain and the central nervous system, and then the cell bodies on the peripheral nervous system in the actual ganglion.
Mm,
And, this is where the impulses are redirected into a different pattern, or a different movement, or, so we get the information, the intention, and then this finer tuned into something more specific. And I forgot who said this, but one of the scholars was talking about, the spirit and, the spirit being manifested, having a direct, I think it was Charles Hannell. Is
mm,
it Charles Hannell? Yeah, Charles Hannell. And when you read his book, he has a whole programming of manifesting things. And he talks a lot about how the nervous system is so connected to the spirit,
yeah.
you know. And from our nervous system, we're able to manifest the will of the spirit, So it's not just such a physical thing. When we look at it in a bigger picture, we can see how we can use our nervous system to program our whole reality, But we'll never really appreciate that until you do the daily work for it. It's just like learning a skill. What I see nowadays, especially, in my environment, the young footballers around the local park, the way they train, and you can see at such a young age, they've had good teachers and good coaches and parents that are drilling
Yeah. They're
this
getting good support. It's
behavior,
true.
and it's drilled into them. And they're doing things that, I used to see people do when I was 16. They're doing that 5 years old or 8 years old. And the evidence is there,
Yeah.
But we do this for one level, people don't do it at all. So they will never understand the beauty of their nervous system. On the second level, you see all the young athletes do it. But on a rarer level, we don't see the everyday person or very few people doing the same thing to cultivate their spirit,
Hmm.
you know. And I suppose that's just, again, different levels of awareness. But when we do use it and understand that to cultivate our spirit, becoming rich or whatever, I don't think that should be a problem. If that was what one desires, most people complaining about, oh, I'm poor and this, but they've never really practiced such things. And the people that usually do practice such things, a lot of them are not even interested in money and wealth. So it's a funny thing where the people that want the things that the nervous system can give them don't practice, and the people that practice are not even interested in it because they've realized the power that their mind is in just a different place.
It's true. Most people who are successful and they tell their story, it does seem like they got a really good imagination. And that imagination
Mm.
they've captured from a young age and they're able to actually manipulate their mind because of either trauma, stress, whatever problems that they may have encountered, where they had to go into
Mm.
themselves to find a way. Unless
Yeah,
they were a genius, he was just creative and they were creating stuff and they were just in their mind anyway. because they were descriptions.
Mhm, mhm,
Yeah, so one more thing. Sankofa was asking about the, because you know with the brain, because is it the same for the other
mhm.
side of the brain? Is it the same? Because you showed one side. Are both of them the same?
Mm. Yes and no.
Oh
Yes,
yeah. In what situation will it not be the same?
yeah. So yes, in the sense of, the body is designed to have an equilibrium. So what you see on the left, God designed the same on the right. But what we see now, we have a one-sidedness in life. So some people are accessing, right-handers might see that the motor cortex on the left side is a little bit bigger and developed, whereas the people who have a less dominant side might see, the strength and the thickness of the nervous system less developed. And we just know that we just get someone to stand on a wobble cushion on one leg, and I'm sure one side will be better than the other. And even the way we stand and the way we posture, some people might stand a little bit more on their left leg. So now they're getting a little more neurological input,
Mm,
you know. So although we was designed to be symmetrical, we're not. And then, then there's life abuse that we do to our body. And abusement is that, by chance, something might be more affected on one side of the body. So someone might have more of a buildup of plaque on one side of the body. When someone has a stroke, it is usually on one side of the body, or one part of the brain, a specific part. It's not usually both of them. Oh gosh, that would be devastating.
mm,
But it is usually one side, you
mm,
know. And then the more we look into spirit and the bigger side of things, we'll see that actually it may have happened on that one side because of a whole nother metaphysical reason that we might not be able to explain now, but I'm pretty confident we'll be able to explain in the future, you know. Yes, and Kofa, you raised your hands. Let's see.
Oh, yes, yeah. Yeah, I just wanted to clarify that because don't they say that one part of the brain is there's more like access to creativity, and the other
Mm,
side is more access to a logical, analytical way of
yeah, yeah.
perceiving or
You
acting?
know,
Mhm.
I always see that. I mean, I'm not too sure how much of a truth that is, but I've always understood that kind of by way of concept, like yin and yang, you know, like ro-
energetically.
yeah, yeah. That's how I understood that. Um, I haven't looked at any tests or research, but I wouldn't be surprised at the same time. But from my understanding of the right brainness and the left brainness, I kind of understand that more as a energetic, more of a concept of things. And the reason I say that is because within did you see the diagram where it showed that with the corticospinal tract, which is the motor tract, as it was going down, there were some fibers that most fibers actually crossed. I don't know if you saw it. So that's how you get the left controlling the right and the right controlling the left. But then I don't know if you saw, but there's some fibers that don't actually cross, that stay on the same side. And also in doing that, it's almost kind of like there's a protection or there's a little bit of preservement of the right and left-sidedness of things if something was to go wrong, with the body. So, I think that if there was just a total crossover, if we had an injury on one part of the brain, I think, we might have more of a loss. But I think the body is smart in a way where it does preserve some of it for such things and maybe just to assist. But the body, God knew what he was doing when he was designing the body, you know. But I think it's the right side being, I think they say right side is more no, left side is more creative, I believe. You
Yeah,
know, right side is more logical. I think that's a concept.
yeah, that's the concept. But then in the prefrontal cortex,
Mm.
that's not even divided, is it? Because if we're talking about creativity and logic,
Hmm.
it's like what part of the brain, from what we know at the moment, goes with logic? But yeah,
I mean, we definitely group it into the frontal cortex, rationalizing, you know. So if I saw a stroke patient that's had injury to the frontal cortex, you know, there will still be some rational skills. You know, one, it depends on how big the injury is
mm,
as well. And you know what? With the brain, it's not like the brain is like your brain will resemble someone else's brain. So you might find that your motor cortex is a little bit shifted here, or it might be even a little bit more expanded,
hmm,
you know? And then what we, you know, we see is that there even might be other parts of the brain. I think from the stroke studies, we see that other areas can kind of take over or, you know,
encroach.
kind of neuroplasticity build and have another kind of a framework,
Hmm,
you know. And the brain is like the universe. It's like the sea. It's like the galaxy. It's like the mind. There's so much of it we don't even know about. This saying we're only using 10% of our brain. You know, I mean, that's not a lot of percent. So it's like, okay, well, what's happening to the other percent? You know, can we utilize that? I believe we definitely can, you know. And, you know, back when I first started in the physio as a student in the early days, you know, they used to limit, I don't know if they still do this now because it's different when you're in private practice. But, you know, they would say the first 6 weeks of a stroke is where you're going to get the best neuroplasticity, which is the best growth. Then they say, you know, up to the first 6 months. But then the reality is showing that as long as you stimulate the brain, you know, recovery can happen years later. And what I really see, and this is the truth about rehab and rehabilitation, is people get to a limit and they just don't continue. They get to a limit
yeah,
where they just stop. And that's like a limit which almost you think is at the same limit that made them go into the same problem that they, you know, that was created for them, you know, because sometimes there's a certain, you know, through our life, through our experience, you know, we might get to a certain point and then we might not do more. We limit ourselves, you know, and that might be through healthy living, which a lot of the times creates a situation in the first place. So people not willing to change lifestyle because they feel powerless or because it requires a lot of energy. So if you had that before someone's got a stroke, it's going to take a lot more energy after a stroke. So is a limitation of rehab because of those reasons. Whereas, you know, we see that people who are just extremely dedicated and determined, and it's rare, you know, it's really, really rare that these are the same people that can achieve marvelous things. But it's really appreciating how much energy it takes to change one's behavior to not allow them to get in a problem in the first place, but then what it requires a lot more energy for them to even get past the process or progress once they've got a stroke or something like that.
into the next part, it's going to present nervous or this neural network. So we've got this cell body and these axons and these synapses, and these things seem to be throughout the whole body. we've got cell bodies, we've got brain cells in the gut. It seems like we've got them all over the place. But in this, I'm just going to go through the plexuses, the nerve plexuses in the body. And when we're looking at the nerve plexuses, now we're looking more towards, when we're thinking metaphysically or esoterically, we're thinking of the chakras or the energetic wheels or the energetic centers. Yeah, we're looking more at the plexuses. Most of the time, when it comes to the yogic system, the plexuses are directly aligned with these chakras. When we're looking at any other world system, it's the same. When we focus our consciousness in certain locations in the body, generally, especially when we're looking at the midline of the body, then generally we're looking at these plexuses. And these plexuses, as the word plexus refers to web, these plexuses, there are, let's say, 9 of them, 7 that we're going to go through, 9 or 7 we're going to go through. And most of them are actually well known, and some are known by other names. So through the spine itself, we have these paired or 31 pairs of spinal nerves as we go down. But along the spinal cord itself is where we find some of these plexuses. The brain's a bit different. So when we get to the brain, we're going to have to shift it a little bit and just look at it from a different way. Because really, plexus, in the sense of from a nervous system point of view, is through the body. And in the cervical, in the neck, we've got 8 pairs, thoracic, 12 lumbar, we've got 5 sacral, we've got 5, and in the coccyx, the coccygeal area, we've got 1 pair of nerves coming out. And we're going to start with that area there, the coccyx. So the plexus, or the group of nerves coming out at the bottom, this anococcygeal nerve, second to the bottom there. In this space is where we're looking at this coccygeal plexus. If you look at the bottom circle there, you see these pair coming out at the bottom there. That's referred to as the coccygeal plexus. And that particular plexus, being right at the bottom there, when stimulated, because it innervates and it also sends information to the groin area and down the legs. But when innervated, the coccygeal gland is stimulated. And because these pulsations are very close, so at the bottom of the coccyx, you have a gland. I didn't even put an image of it there. But that gland there, when stimulated through pelvic floor movements, pelvic floor contractions, or any kind of stimulation to the lower area, the basin of the pelvis itself, we start to develop neurological actions, or we also create blood cells. And this increased stimulation of blood cells at the root, what they call it root chakra. We also call that area there the lacrimal gland. Should have wrote that down as well. But when it was first discovered, it was given the name of the person who discovered it, this particular gland. But that stimulation of that gland there helps to create more blood cells. And when we're doing internal works and we're contracting this area, the area does become rich in blood. And it also can feel like a tingling sensation. And that tingling, generally observed as being an activation or some kind of stimulation. It can happen through falling, being knocked, fall on your coccyx, That can also cause the coccyx to be displaced, where you have to actually readjust it back into alignment. But if you haven't knocked it, if you haven't hit it, if you haven't done none of these things here, and you've just been either doing pelvic floor contractions and you feel at the base of the coccyx a stimulation, then it's this what's going on. This coccygeal gland is being stimulated and it's producing more blood, and it's actually stimulating cerebral spinal fluid, and it's stimulating flow of energy up the spine because it's at the foundation. So then from we have the coccyx right at the bottom, that plexus that comes out. Then we have the sacral plexus. And the sacral plexus is in the sacrum area. And the main function of the sacral plexus is to stimulate or to send information, sensory information and motor information down the legs to the foot and aspects of the pelvis. A part of that coming out is the sciatic nerve on that image there, where piriformis is just there as well. But then that sacral plexus, when doing our pelvic tilting, our pelvic floor contractions, again, we're tonifying and calming and stimulating the nerves in these areas there. So as a result, the lower limb has an increase in blood circulation. The foot has an increase in blood circulation. And also, it's able to deactivate any kind of pain or discomfort. So these plexuses are like this. And because, the nerves themselves, when they branch out, as they branch out, it's like they just become smaller and smaller fibers or nerve cells. So it hasn't been discovered to which depth they disappear when we are looking into the end of a nerve, when it starts to travel off. It seems like depending how powerful the microscope is, determines how much of the nerves you can still see. So to the power of the microscopes at the moment is what we can see. But it seems like each time they get more powerful, the more nerves we see, and they spread out. So they spread from the body. So at each layer, although these nerves are emanating and coming out from the spine or amassing as these plexuses or these groups of nerves as a gathering center of information, when they come out from that space, and we're looking at the sacral plexus at this moment, when they're coming out and it's descending down the legs, all that information there, those nerves which go into the feet or that go into the thigh, when you come to looking at the nerve endings of them, this is when we observe that there's more stuff, like there's an interaction between the physical or the inner world and the outer world through our nervous system. And we're in the early days of truly appreciating that wonder. Because these things are expressed in the metaphysical sense or in the alchemy, in the esoteric sciences, but then they are validated later through modern science. But at the moment, it's like they're just catching up with the philosophical points of view. So when these nerves descend down, depend upon which part of the sacrum determines which part of the actual body is stimulated. We call this myodomes and dermatomes when we're looking at it from a clinical point of view. So we can actually see which part of the sacrum is actually damaged through touching or rubbing or pressing or stroking certain parts of the body. But again, that's information fed to the area which is a two-way information receiver from the outer world to the inner. And so we've gone through the sacral plexus, and usually that's associated with a fire quality and the coccyx. And we will still associate this to the lower dantian. And now we're in the lumbar plexus, in the lumbar spine area, lower back. And this group of nerves from T12 to L5, this is how the highway come out of the spine itself and how they cross over. But these different nerves coming out, they innervate and are involved with some of the major muscles, which are the psoas in the center, quadratus lumborum from the first rib to the hip, lumbar transverse, the transverse lumbar, sorry, at the back, the quadricep muscle on the thigh. So we got, and the obliques on the side. So these different nerves innervate those particular areas. Again, when we tonify, work on that area there, opening up the back and expanding the back area like a pump, releasing the tension in that space there, doing like kidney shake and stimulating warmth. Because you know when we're doing a lot of like during stretching, a lot of rotational or folding or bending activities to open up the area. And that is to tonify, to allow the nerve impulse. Because when there is a blockage on the vertebrae, where the nerve is coming out of to create a peripheral nerve, when there's a blockage, then there's constant feedback going on, which creates discomfort. Immediately in the area, this can create pain. So through the activities, and this is still all lower dantian, we are opening up and freeing up the space. So psoas and quadratus lumborum and these obliques, this whole spinal engine is really worked through, supported with the lumbar plexus. Lower dantian lumbar plexus. So we've gone through the coccyx plexus or group of nerves that come out, and they stimulate this coccyx gland. Then we have the sacral plexus, which is immediately for the genital area as well, the pelvic bowl. And then we have this lumbar plexus, all lower dantian. And then well, because the way in which the spine works, that it's hard to divide certain things. So some of them are truly both working together, like they cross over. So the lumbar sacral plexus, or sometimes it's called the lumbar sacral plexus, where you have the merging of these two plexuses together or groups of nerves. And it's really, when we're looking at the plexus, it's a web. But remember, we're dividing the vertebrae and we're giving each segment or each group of nerves in that segment opportunity to express what work it does. And when we're doing our internal work, when we're aware, then we know how we're actually affecting or improving our neurological feedback. So from here, we go into what we would call we're still in lower dantian, because lower dantian, as a specific place, we say beneath belly button, but as an area, is like your abdominal area. So that means we're looking from beneath the diaphragm, really. Anything beneath the diaphragm, we're looking at as lower dantian, what we're cultivating. All the energy centers or all the plexuses of nerves that are in that particular space, we are cultivating. So the celiac plexus is what we refer to as the solar plexus. Sorry, the solar plexus. The solar plexus. So just beneath the diaphragm. if that place there gets knocked, if it gets hit, if we get punched in that area there, we get winded. But then this celiac plexus at the level T12, yeah, about the level of T12, is mainly a gastrointestinal effect. So from here, the nerves that branch out of this particular plexus, because this is on the aorta itself. And it's interesting because with looking at the plexuses, it's like it's one or the other. It's either the nerves you're looking at, or it's the blood vessels you're looking at. So it's either really you're looking at how the blood vessels, how you have a group or a network of blood vessels doing a job, or you have a group of, and then it extends itself into the lymphatic system, and then it also extends itself veins. But from the celiac plexus, what we call the solar plexus, we have the effect of the stomach, the pancreas, the spleen, the liver. All these different organs have innervations from this particular plexus. And then so now we jumped from lower dantian space, and now we enter into the middle region. So there's a lot going on in this lower area. And when we're looking at it from a psychological point of view, when we're looking at it from this point of view, this is why there's so much emotions connected to the gut, or so many issues that we can find related to our trials in life, how this lower dantian is related to Earth itself, or the lower aspects of our reality. Like there's so much information being received. So much information from the outer world is received in this lower portion. The energetic output may be quite large in the middle dantian, in the heart space, and it receives a lot of information because we do have a few plexuses, like the pulmonary plexus in the in this space as well. But this lower dantian nerve information, especially when you bear in mind that the exchange of the nerves between the outer world and the inner world. And then when we're looking at the outer world, in the old world, we would say, let's say Greek times, we're talking about the ether. So this tangible energetic space around us, when we're feeling the energy around us and we're communicating with that particular space there are nerves that are so fine that they're interacting and feeding back information to our system on what it's picking up. And it's not just the physical ones. Well, we can't even see that on a microscopic level, let's say with our own eyes. It's all laboratory, isn't it? So we have the cardiac plexus, and the pulmonary plexus, which generally we will operate together. And then amongst this, the main thing it does is offer support to the heart, this plexus of nerves. So I would still place this in the middle dantian area, although we're entering into this upper space, because that would make the story done quite quick. Just the pulmonary plexus and the cardiac plexus. But this brachial plexus, because it operates outside of the skull or the head itself, which is considered the upper dantian, then it's like in transition between the two realities, which is an expression of what it does. The ability to manipulate the world around us and reality. And then from T1, which is like the base of the neck, from the base of the neck up to about C5, which is halfway up, let's say approximately, of the neck, we having this brachial plexus going on. And the main function of our brachial plexus is controlling or innervating the muscles of the arms, the forearm, hands, and the fingers. Sensory and motor information going on there. Between this brachial plexus, so between this, along the cervical, along the cervical, we have two plexus, I should say, which is the brachial plexus, which we generally talk about. And then we have the upper part of the neck, the cervical plexus. So if we're going to use, so that would be like the throat chakra, the brachial plexus, and the cervical plexus. This will be the throat center, the energetic center in the throat area. But from a motor functional, the upper area between C1, 2, 3, 4, we have our side bending and our rotation. So when we're doing our activities, which involve this general side bending or rotation, again, we are tonifying, stretching, opening, and releasing. The thing is with the nerves, now when they're compressed or when they're stressed for too long, the feedback that's going on has caused the body to go into some kind of mayhem. So the ability to keep the whole spine lengthened, stretched or open or upright, and even lying on the floor and aligning the spine and allowing it to sink into the floor, wherever you're hugging your knee. And we're not talking about here, bending your leg left or right, but keeping it in the center allows the opening, allows for the plexuses along the whole of the spine to do what they need to do. So as we have the C1, 2, and 3 at the top there, which do the movements that we just mentioned there. And also they supply the muscles in the neck, the fascia. And it's the same, you know, for some of these other plexuses as well, when we're innervating sensory and motor tissue. Fascia, a lot of the time, is also being innervated. So this is, let's say, but when you're looking at the internal alchemy and you're looking at the space between lower, middle, and upper, you see a field where the diaphragm is. There's like the diaphragm is flipped upside down in this internal alchemy map. But when you go further up and you see the neck itself, or the representation of the neck representing internal alchemy, you see like a, I think it's a 12-leveled pagoda or tower, like the stairway to heaven, a representation before it enters to the upper Dantian space. But the upper Dantian space is an interesting thing to observe because as it's neurological tissue, and because there are sympathetic chains, there are chains moving through the actual brain. If we're going to look at the options in the brain that operate as, let's say, a network, like a plexus, and work together, then we have these circumvicular organs, which operate, and most known out of all of them is the pineal gland, which they generally call the pineal organ. So this is neural tissue here. So we have our pineal glands, which from the bottom, we have this blood being stimulated as the cerebral spinal fluid is passing by. And then we have at the top, we have this pineal gland, which supports internal travel, meditation, or the release of DMT. It secretes pinaline, and there's a few other things that it does secrete actually. But from the pineal gland, or these 7 that work together as a group, we also have the 12 cranial nerves, which work together. Well, let's say they are grouped in pairs. So there's 12 pairs that are coming out from the base of the skull, nerves. So between that network, so then we can say there's 12 networks going on here. Amongst that, we have the only aspect of this region or within the brain that's referred to as a plexus is the cortical plexus, but this doesn't have neurological tissue. Although it's within the brain, it's like the circulatory system, which is there to support our 7 glands, which are operating within the 4 ventricles in the center of the brain. So this plexus here, because where it functions, where it operates from, so we have our ventricles, and within the ventricle space, we have these plexuses, or these locations where we are processing cerebral spinal fluid, releasing cerebral spinal fluid into, so that would be like a filtrated, ultra filtrated version of blood that's circulating within the space there. So then this space helps to transform blood, refined blood, into cerebral spinal fluid, or into an ultra filtrated form of blood, which releases into the ventricles, which circulates and stimulates them. But this is the plexus within the brain that we're looking at. And that operates on a endocrine level, on a neurochemical level, a neurotransmitter level. It offers information throughout the whole body. So within our, let me end the presentation because that is the end of the slide, but I haven't finished fully yet. So within the body, we have along our spine all these different layers or levels, and all these different levels send peripheral nerves out, and these second layers receive information or send information or do activities. And if we go through them from the coccyx plexus, the sacral plexus, then we go through the lumbar plexus or the sacral lumbar plexus. Then we go for the celiac plexus, those 4 plexuses. When we're doing lower dantian work, we're really stimulating this aspect of the spinal cord to receive and give information and to function optimally. Then when we enter into middle dantian, we enter into the cardiac plexus, the pulmonary plexus, where we're able to receive information, muscular, sensory information, tonifying the space through the diaphragm. Then when we pass 4, 5, 6, then we go into the brachial plexus, controlling arms, got the lumbar plexus, and a bit of the sacral plexus is controlling the lower limb and receiving information. And then we have our brachial plexus and our cervical plexus, which is doing the information from the neck and the arms. And then we have the one plexus in the brain, the because again, as it is a neurological tissue, and we're looking at switching the thing around a little bit, because we do have the tracks that move through, and we do have these chains that move through. But then a chain is a chain, isn't it? And they do have branches that come off of them, but it's a bit of a different organization. So then it's difficult to call it a network in a space, in a hub, because the network in itself is moving through and down, although it may spread, but each section itself may be given a different name. So therefore, those inner vessels are not really same as this the vagus nerve or the sympathetic chain or the vertebral chain that's coming up beside spine or the stops. So the plexuses in the lower part of the body are far more easier to understand from a neurological point of view, and being able to connect it to the energy centers. But when we're looking at the upper, because generally we're looking at the pineal gland and the pituitary gland, but there are other organs and they work together collectively as a network, because all of them are actually secreting different things, and they do require each other as a support, making them truly a network. So it becomes ganglia or glands with neural tissue that we're looking at in the brain from an energetic point of view. All right, so I think I'm gonna finish the presentation there.
You know, it's interesting this when you're talking about the difference between the higher and the lower plexuses, because you can, yeah, so even within the Tai Chi, when you're looking at the sacral plexus, you know, and then you're kind of looking at you know, so in total, this is a question first actually before I go into what I'm saying. So in total, is it about 7 plexuses we're talking about if you break it down?
Well, coccyx, sacral, lumbar, celiac, that's 4. Then
Yeah,
the heart,
yeah,
then the pulmonary, that's 7, isn't it?
mm, yeah,
And
yeah,
the brachial, and then the throat chakra, isn't it? And
yeah, yeah,
so that's 8.
yeah. So it's all right. And
That's
then I'm wondering, even in the explanation, if you had to compare it to the, let's just say, chakra system, would you group some of them together? So, for example, with the sacral and the coccyx,
into like 1.
yeah,
I mean, I think the sacral lumbar is definitely grouped together.
mm,
And I think because the coccyx is just so close together, isn't it?
yeah, yeah,
So
yeah,
it's so
yeah,
easy compared to the celiac plexus, and true, that's in a different kind of location, because it's so
mm,
interesting how that plexus that is innervates so many organs, that those
mhm,
group of cells are networked on the aorta of
yeah,
the
yeah,
plexus.
yeah. Because even when if you have to bring your awareness, you know, when you're bringing your awareness to a certain area, you
Mm.
know, it's kind of like in my mind kind of will group it all as one.
Yeah, that's why I say it's like it's all of that below is like lower dantian. That's why I group it.
Yeah, yeah, yeah,
That's why I say all that
yeah.
stuff is all those are like lower dantian, one thing. Yeah, that's I do look at it that way there,
Mm,
as I do put them together, ironically,
yeah,
and then
yeah,
separate.
yeah. No, no, it's interesting.
The
Yeah,
plumerian.
it's interesting because you got, oh, go on, go on.
I was going to say, and then I'll put the lung and heart plexuses as a
Mm,
those can group together, and the same as the brachial plexus and the cervical.
mm,
Even though from a musculoskeletal point of view, they are, and from a range of motion, from movement point of view, they're doing different things.
yeah, but it's still an extension.
Yeah,
The brachial being that extension from the cervical.
that's the thing. So they merge. That's why we have pain
Yeah,
or referred pain, isn't it?
yeah, because oftentimes anyone comes with brachial plexus problems, I'm treating their neck the same way.
Yeah, no, definitely. Like you can't if you yeah, if you're a bad therapist. If they got our problem, you don't treat brachial plexus, yeah, or you don't look at that. Yeah, there's something going on over there.
Mm,
But the most won't even know that's what they're doing. I mean, let's say study,
mm,
or they're just thinking they're releasing the vertebrae or the muscles in the neck because the neck's tight,
mm,
and it may be
mhm,
a fluke.
mhm.
It's a fluke thing.
Yeah, 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 yeah. Because when you're doing things like, because all of these systems, they definitely cross correlate.
Yeah,
Whether you look at the plexuses, whether you look at like the endocrine glands, the chakras, the dantians, the
you know what I'm saying?
microcosmic orbit,
They all
they're
connect.
just different awarenesses of the same part, you know. So yeah, no, it is interesting because again, I was watching a video and it was talking about the metabolical system, and even in reference, it was talking about energy. If I remember who it was interesting because she was then talking about energy, but she was talking about energy as a point of view of what if we had to start off with, let's just say that just the sexual organs
Mm-hmm.
generating that energy on that sacral level. Then
Take
you looking at
plexus.
that, yeah, and then moving a little bit higher into the navel stuff, where the energy starts to make a little bit more of a direction, and then when you go a little bit higher to the wheel, and then the pancreas, and then that whole pancreatic system, having to be at a certain balance to even be able to create and utilize the energy, because we know the pancreas is dealing with, the how your body harnesses the energy or harnesses glucose,
Yeah,
you know. So then that's the energy being more controlled in as it's rising, the energy being more um utilized in a very controlled, very this is something that the body metabolizing to make better use. And it's just really interesting how you got all the metabolic systems and how, again, it's dealing with just energy, you know. And then we got our, even going higher, where you're looking at like the throat and you see what the thymus glands are doing.
hmm.
And you see that people with all thyroid or thymus problems and, how then they deal with the imbalance with their weight, you know.
Hmm.
So we can see at every level, all of them are dealing with the metabolic system, which is basically dealing with how we harness energy.
Hmm.
And then what are the things, the thing that we didn't touch in the nervous system is looking at the, autonomic nervous system
Yeah,
and then the parasympathetic system and the sympathetic system. because it's again dealing with that same energy, the rest and digest, and then the fight and flight.
True.
So
Didn't even
yeah,
go with the divisions, even the enteric system.
oh, yeah.
That's a true network there, the enteric system. And that,
Mm.
like
So,
that one there overcomes it all. They don't even call that a plexus. No, hold on, no, there is. Um, yeah, but that's a complicated one though.
mm.
So,
So
anyone
yeah,
got any questions there before we expand into the rest of the evening? Anything on the brain, anything on the nerve plexuses, the plexuses in the body, the networks that we've reviewed today. And when we're looking at these networks, because Christos did bring it to my mind when he was just, explaining what he was just explaining a moment ago, that it's like you can, as a place to focus your intention upon, when you're looking to, in your mind, to improve certain qualities within yourself, certain activities, or certain, and from a energetic point of view, from a battery storing point of view, to collect energy, for that energy to disperse through the rest of the field, like a central point,
mm,
because these would be considered wheels of energy, or places where energy is collected, or there's more electrons in that space, like a hub or a group of electrons at its most dense location, before it dissipates through the rest of the system, or it receives
mm.
from outside to the central location, to the hub of information. Mm?
Yeah, yeah. It's all energy.
You know? And sometimes we be tracking these invisible lines and marrying these invisible lines up to tangible, visible structures, like what we're
Mhm.
talking about, yeah. Like we would say,
Yeah,
yeah, they align it to these structures, and it's not the
yeah,
language that they're using. But I
yeah.
think in the past, in a certain time, it wasn't investigated or discovered in that fashion there. It wasn't
Well,
discovered that these
we we know by when we look at the veins, the arteries, we see how they travel. We can see how the nerves travel. And when you're looking at that, you can see the meridians. Well,
yeah,
you can't physically see them, but we know how they travel. It's the same way.
yeah. That's the thing there, isn't it? That's what we're reviewing. Uh,
Hmm.
the When we're looking at nerves and we're looking at them and we look at them under a microscope, the what we can see, it then more becomes apparent because it's crossing over. So what I'm
Hmm.
saying is, like, because of this crossover quality of nerves, because of this crossover quality, or its disappearing act, because it disappears,
Hmm.
because it disappears
Hmm.
and it interacts with the energetic aspect of this reality here, let's say, because it disappears.
Hmm.
They come, like I said, those that vanish, it's a possibility that those are the same meridians and channels. And then
Hmm.
when them thing there through microscopic observation becomes gets more powerful, then these things will be probably seen. But they come, like I said,
Yeah.
but unless something else is going on from tracking these energetic sensations,
Hmm.
that's what it is, isn't it?
Yeah. 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 It's true.
Yes, I. So yeah, Alan's got a question there. What is the connection between the nerve plexuses and the 12 meridians?
Yeah.
Yeah, because
Well,
you mentioned meridian lines. Yeah.
mhm.
Um, are meridian lines the same as the nerve ganglions that you
Mm,
earlier mentioned in the presentation?
not directly like that. Not from
Traditionally,
awareness
no.
or not from the textbook standard of things.
Yeah.
But what I do know, they say it has. I think the Earth might have. Is it, see, because what they're saying in one book, there's this guy. He worked as a doctor, and he didn't like the word meridians because he always said um, that that's what the Earth has and not the body. He said that um, energy lines are more fitting, you know. But in terms of that question, no, because the ganglions are very physical things. But then at the same time, when we're looking at the I think it's a conception channel and a governing channel, we know that I forgot what one it is, but the one that runs at the back, you know, we can see a correlation between that and the microcosmic orbit,
Mm.
you know, because we know that
But those are a
you're
bit different. I think the extraordinary vessels, the
mhm,
extraordinary vessels which feed the 12 meridians. Because when you're mentioning the conception and the governing vessel, we have to appreciate that them ones there are truly extraordinary vessels, and
yeah,
they are a separate system, although integrated into the 12 meridian system.
yeah. And then at the same time, your body, there's 12 meridians of the body at the same time, you know. So yeah, I believe there's 12 meridians of your actual body.
Yeah,
Must
those 12 meridians of the body,
muscular.
that's the ones I'm referring to. I think they
Yeah,
go to your different organs,
yeah,
your heart and your
yeah.
bypass.
So you've got like the kidney, the bladder,
Mm.
the heart, and then I think it's times two. It's a times two.
You got
So
two of
you've got yeah. So you've got your heart, you've got your spleen, you've got your bladder, you've got the kidneys, you've got the lungs,
mm,
you've got the gallbladder as well,
Mhm.
you know. So
the triple
yeah,
burner. That's a part of that one.
well that's more, yeah. So yeah,
But that
so
links up
yeah,
the tree in it. The tree, the
yeah.
lower, middle, and upper dantian, or the lower burner, the middle burner, and the upper burner.
You know what? So it could be the 12. I need to have my thing right to see it because I do use all of the meridians when I'm doing acupuncture. Then you've got the governing one, your conception one. So yeah, it could easily be 12 on each side. I think it is 12 on each side,
The thing is,
because
it is like a ley line. It is like an
yeah,
energetic line that you're observing. It is like a current of energy. But the reason why
yeah,
I was
yeah,
saying that, because the way nerves, we're only able to see to the level that the microscopes give us the ability to see, and because they interact between the unseen world, the ether, or the micro aspect of reality, because they interact on that level there. Those vessels, it's quite possible that they're still the same extension of the nerves
Mhm.
And
Mhm.
when technology gets better to see, then we'll see them materialize. They're just at the moment unseen.
Well, yeah, well, that's like everything in the past as well, because we're always dealing with that reality of the unseen and the seen, and
Yeah,
it's like even on the Matrix, it come like the zeros and ones, you know,
where we are, Alan.
and yeah, what we see is only what we can perceive by the five senses. So before a reality is if we can't feel, touch, taste, smell it, or whatever, then it doesn't exist,
Hmm.
you know. But then we've seen how things are beginning to exist, just things exist only by way of our perception. Because now that we can measure things, the things that we can measure that we couldn't measure in the past are now real. So
Yeah,
if that's the case, then how much more things are real that we classify as unreal? So, energy is something that some people can already see with certain cameras, and some people can see already with their naked eye.
hmm.
Your aura and discharges and energy and clouds, and I think we can all see it to a degree. You just have to be in a room with a negative person, and you want to walk out if
Hmm.
you're of a certain vibration. And so that's why I think it's very important for us not to let Western society tell us reality, because all they've told us so far is how to close our eyes from true reality.
But the eight vessels do follow a pattern, which is quite similar to the main trunks of the nervous system. When you're looking at the hill thrusting and the hill linking extraordinary vessel, they call them sometimes meridians as well. The
Okay.
extraordinary with bad language, but they still follow a vagus nerve kind of, sorry, a sciatic nerve kind of branch. And when you're looking at the same one that goes through this around the waist, the Dharma, it come like it look like the sacral lumbar plexus.
Yeah,
What it
well, you're
indicates
right.
is quite similar to what it said to work with.
Yeah, yeah, because I know for certain when we're looking at the bladder meridian, because that's the meridian that, I always would acupuncture. And when you're looking at that meridian, you can see it following the sciatic nerve. And you can see even in the lower back, you can see it following the branch of the sciatic nerve as well. Even from the way it comes out of the lumbar spine. Down, down the legs.
Everything.
These things are very clear, very evident.
All right, everybody. I think so. We got finish up.
Excellent.
Any other queries going on there?
All right.
No, thank you.
Uh,
Thank you very much.
thank you for staying.
Wow.
Thank you very much. It would be nice to go through it again at a later date because
Yeah.
it's food for thought now.
What are you saying? Rounding it all up, bringing it together.
Well, not even that. I think when you're listening to something for the first time, you need to go over it again.
Big more than once.
Yeah.
Well, thank you very much indeed, everybody.
Thank you for joining us as well. Hopefully you catch us next month.
God, yeah, and I'll see you on Saturday.
All right then, D. Well, everybody,
Everyone.
thank you for joining us.
Thank you.
And I
All
hope
right, bye.
wonderful evening.
Yeah, everyone has a good weekend.
Thank you. Bye-bye.